Jane Marwick joins me now live from Perth. Jane, great to have you on the show on Friday as always, but before we get to today's announcements and all the detail, the PM made an address to the nation last night. Now, it doesn't happen often, it's actually a rare thing in politics and you use it sparingly. Did he hit the mark?
With regard to the economy, he absolutely hit the mark. He was calm, it was a short, very rational message, but I have to say, and you and Chris Kenny and everyone knows how I feel about this, the health message has been garbled, and I'm on Talkback Radio on 2GB every night, and people still don't understand the health message. And I understand why the Prime Minister had just made those stimulus announcements. I understand why that was what he focused on. We saw something very different from Boris Johnson overnight, where he talked about the fact that lives will be lost. Even Donald Trump talks about washing your hands. I think it's very, very important that the government unifies, and I noted that one of the people who was Vox Pop there said there hasn't been a cohesive message. I think that's because we've got states and then a federal government and everyone's sending out slightly different messages. We need one clear message, and Peter, the message that I think is the most important one is what Boris Johnson's calling the sombrero, squashing the sombrero. And you've seen this graph on Sky News. Certainly Andrew Bolt showed it last night. You've seen it a couple of times.
Yeah, I think this is. We'll put it up there now on the screen because I think you're absolutely right. This is not about stopping people getting coronavirus. That's out of the government's hands. But this is about slowing the transmission so that if it occurs at a rate. And you can see there's the red line if nothing's done about controlling mass gatherings, let's say, and you ideally want the blue line. So it's about making sure that infections happen over a course of time at a rate in which the health system can absorb the casualties.
That's exactly right. So red is what you see in Italy. You've got a whole lot of sick people and not enough beds, not enough respirators. That's without intervention. What we want in Australia and what the UK wants and the United States is hoping for is blue with proposed action. Now, I do not think any of the health authorities in Australia have explained that, and John Stanley and I try and explain it every night. When people ask me about it, even here coming in tonight, I was talking to people saying when we're not having these shutdowns and we're not having these restrictions to 500 people because the government thinks everyone's going to die tomorrow, it's just so we can even it out. And I do think the next time the Prime Minister has an opportunity, Peter, he needs to show that graph, because that graph is the very best, easiest way to understand it.
I think the other thing to note, around Australia at any given time, in all of our hospitals, you think how many we have? A place like Geelong has 3 major hospitals. We only have about 2,000, and that's not a lot, available intensive care beds. Now, if we have a run on those beds and people are not in them just for 24 hours, let's assume they're there for 2 or 3 days. Intensive care bed comes with the respirator. A lot of the time we've seen overseas that people who have coronavirus badly require a respirator to keep them alive, to keep them breathing. Now, if we have a run on those beds, if you look at that graph and you go with the red line, we couldn't cope. But if you're able to flatten it out, those that tip into that very bad, 10% category are more likely to be able to be saved. We want to avoid a situation that's being talked about in the United Kingdom. NHS protocols have been issued where doctors will be required to make judgments. If 2 people present and there's 1 bed available, who's more likely to survive? And usually that comes down to age, and that person then gets the ICU bed. This is why it's so important that it slow down. Do you think we should have done this earlier, Jane?
Yes, I do. I think it's vital, and that is what's happening in Italy. Doctors are having to decide who gets that bed with that respirator. You know that I was in Singapore. I want to show you this. This was the front page of the Singapore newspapers from the start of February. I saw it like that. The government was sending out messages on the Straits Times, wraparounds, telling people what to do. Okay, they haven't got states like we do, states and territories, but I think one clean, cohesive message is what we need now. I think the announcements have been good. I think the fiscal measures have been pretty good. I've talked to some tradies who are very happy about the apprentice payments and those sorts of things. But I think when, again, being alert, not alarmed. But Peter, you and I know this. Knowledge is power. Singapore's been very good at it. Just advise your citizens what is happening, why you're doing it. Keep calm, carry on, wash your hands, be careful, but keep going to work.
Well, and there's also, as we know in the announcements on Thursday, the announcements on Wednesday, these are the health announcements, not the economic announcements, but there's $30 million set aside for a public information campaign. I agree with you, Jane. I'm really surprised that it's coming as late, because if the money's only there on Wednesday, I've done these campaigns, it'll be a good 4 or 5 weeks before all the collateral or the ad work and things go to market in the ad buy, before we see it on TV screens and likely see it in newspapers. And I think the government's got to throw all the resources at this to get that out there in the public as quickly. I said at the start of the show, I think it's as clear as mud when people talk to us about social distancing. What does that mean?
Yep, and I'll tell you who, and I can't believe these words are going to come out of my mouth. Bill Shorten yesterday with Kieran Gilbert on this channel was spot on. His messaging was absolutely right about social distancing. We haven't heard enough of that from the government. Now, I'm not being critical of the government, because I know they're doing their best, but it is time now to tell people what to do, and to also, the other thing, older people are extremely worried about their health. So just give them information, prepare them for what is to come, and we're all in this together. We'll get through it. We know we will, but just let's get the messaging right. Let's have a really good, clear, concise public health campaign right across newspapers and across social media.